All right, we're going to go over vascular exam and gowning procedure for week 3 visceral diagnosis. So we got Nate here, he's going to help me out. So we got Nate sitting down. I'm just going to need you to get on the table, Nate, and just lift your legs up, put your head here, okay? And I'm going to grab the back of your gown so it doesn't get caught. All right, can you lay down for me? Sure. All right. So you just want to make sure that they're untucked from the sides. Okay, and so you have your patient in one gown, and then you're going to take a second gown, you're going to place it over the legs. All right, you want to make sure that it is sleeve side down, because you want the most coverage in this area. I'm not really worried about covering up the feet. I know Nate's feet are pretty bad, but we'll do the best that we can. So, all right, Nate, can I have you, actually, I'm going to start here, and I'm just going to lift this up, all right? And I'm going to bring this up to your chest, okay? And yeah, you just want to make sure that you're not lifting this up as well. So just hold on to that for me, Nate. Okay. I'm just going to bring this up to your chest area. Okay. All right, and then can I have you tuck that into your waistband? Okay. Have this folded up to his chest. Okay, so now the patient has it tucked into his waistband. We have the upper gown up to his chest. And I'm going to help you out of your sleeves now. So what I want you to do is just take one of your arms, cross it over your chest. Doesn't matter which one. We'll start on that side, okay? And I'm just going to place your hand pretty much on the clavicle. I'm going to reach and then grab the gown, and then you just want to tuck your elbow out of there, okay? Just place that there, and then if you can just take your other arm, cross it across your chest, there you go. Place your finger on the clavicle, and I'm just going to have you back your arm out of the sleeve, okay? And just relax. All right, and now the only other thing that we have to do is take care of the lower half. Not going to have you place your hands over your groin, okay? And then I'm just going to roll up the sides. Now you may notice that Nate is wearing shorts. Normally, for this exam, you'd have your patient down to their underwear, but in the, it's just easier right now just to use shorts. So just bear that in mind for the time being. All right, now you can relax. And Nate is properly gowned for this procedure. So we'll go ahead and we'll start on the vascular exam. So for the vascular exam, you want to start off with inspection, and then we're going to move on to palpation, and then auscultation, okay? So with inspection, the first thing you want to look at is the venous pulsation in the jugular veins. Now we can't do this in lab, but what you normally do is you have the exam table up to a 45-degree angle, and then you're going to use a tangential light to look at the venous pulsations in the jugular veins. Okay, and then the other thing that we would normally do is we perform a fundoscopic exam. However, we haven't learned that yet, and we will not learn that in this class. So we'll learn that later. So all you have to do is just say you would normally perform a fundoscopic exam. So the first thing that we'll start out with officially would be to check for skin color. So you're just going to scan all over the body for any variations in skin color. It looks pretty good. You're also going to check skin thickness to see if it's thicker in any areas. And then you're going to check fingernails and toenails. So can you just spread out your fingernails for me? Okay, looks good. Toenails are good. Okay. And then you're going to check the hair condition on the extremities. Those look good. All right, and then you're going to check for any ulcerations or edema. And what we do for edema is you're just going to place your thumb and press in on the ankles. And now if that thumbprint stays, you know how you have edema. If the thumbprint doesn't stay, then your patient is fine. And then the last thing for the inspection is to check the path of the greater saphenous vein and the lesser saphenous vein. And now the greater saphenous vein is on the medial aspect of the leg. So you're just going to want to rotate their leg a little bit and take a look at the greater saphenous vein. And the thing we're looking for is tortuosity and dilation. And you're going to do the same thing with the lesser saphenous vein, just on the lateral side of the leg now. And once again, you're looking for tortuosity and dilation. Now we can move on to palpation. So for palpation, we're mainly going to focus on arterial pulses. So we'll start with that. So you're going to check your arterial pulses for rate, rhythm, amplitude, and contour. All right? And we'll start with the carotid. So we'll start with Nate's neck. Okay? Check that side. Check that side. Okay? And then we'll move on to the subclavian. Okay? And then the brachial. Now, can I just have you wing your arm out a little bit? Okay. And your other arm. Okay. And then you're going to move on to the radial and ulnar. Okay. Okay. Good there. Okay, and then from there, you're going to move on to the abdominal aorta. And a good way to find the abdominal aorta is just go 1 inch out and 1 inch up, and then press. Okay, good. And then from there, we're going to move on to the femoral. Now the femoral is a little bit tricky. Once again, Nate, can you cover your groin for me? Okay. This is just to make sure that the patient feels safe and secure. And to get at the femoral artery, if your gown isn't quite all the way there, what you do is you just place the surface of your hand down like this and slide up. You don't ever want to lift up the gown and then just place your hand under. You want your hand to be seen at all times. So you go here and check. And the other side. Here. Check.
Where are you touching?
You're going to want to touch, what is it, between the acetabulum and
Or the ASIS.
the ASIS and
the pubic symphysis.
And the pubic symphysis. So I'd be a little bit further up going in for that. Thank you. Okay, and then after the femoral, you're going to go to the popliteal. So for that, you're just going to go underneath the back of the knee. And you're going to lift up. And just let the weight of his leg rest on you, and you should be able to feel the popliteal. You place that down. Just let it rest right there. Okay. And then from there, we're going to go to the posterior tibialis, which should be on the posterior side of the medial malleolus. Okay. And then from there, you're going to go to the dorsal pedis. Okay. And then with those, you're palpating the arterial wall for thickness. All right. Okay. And then skin temperature of the extremities. You're going to do that with the back of your hand, and you're going to do it on both sides. So you're going to want to compare bilaterally. And you're going to want to use the same hand on either side. You don't want to switch back and forth, because one hand might be more sensitive to the other or less sensitive to the other. And you want to make sure that you're getting consistent readings. And the only other thing would be the edema, checking for pitting. I mentioned that under inspection, but you actually don't check for pitting edema under inspection. I was wrong on that one. You just look. And then upon palpation, you actually palpate for edema. And then the last thing would be the auscultation. So for auscultation, you're going to use the bell of the stethoscope. And you're going to want to check the temporal, carotid, subclavian, abdominal, and femoral arteries. So we'll start with temporals. And always have the patient hold their breath, hold your breath. Okay. Hold your breath. Okay. And yeah. Hold your breath. Okay.
Which one was that?
And what's that?
Which one was that?
That was the subclavian. And then abdominal aorta. Just go 1 inch over again, 1 inch up. Hold your breath. Okay. And after that is the femoral. So once again, take that hand, slide it up. Oh, I'm sorry, Nate. Protect yourself. Slide your hand up. Hold your breath. Okay. Slide your hand up. Hold your breath. Okay. And then that should be it. The only other thing you want to do is you want to check for venous hum. And with venous hum, you're going to check the epigastrum and the base of the neck. So for the epigastrum, you basically want to go up to the xiphoid process and just go a little bit below that. Okay, so I'm just going to find the xiphoid process right about there. Hold your breath. And you're good. And then the only other place you need to check is the base of the neck. And you want to do that bilaterally. All right, hold your breath. All right, you're good. And that covers the vascular exam.